I grew up with family medicine physicians, always had a lot of respect for them, the ability to take care of me and my siblings, as well as my parents and grandparents. But I think the real clincher was when I was in medical school. I got really close to a older patient and was able to sit with him and his family while he passed away. I switched rotations over to an OB-GYN rotation at that time, and about 2 weeks later, I happened to be on the rotation when we delivered his very first grandchild with a family that I had already gotten to know well. That was the moment when I knew that I really wanted to take care of all generations. I saw the benefit of being able to take care of the scope of the family. I knew the background. I knew her father had just passed away 2 weeks prior, and the uniqueness and the moment of having that first grandchild without your father there was magical, and being able to be a part of that really is stuck with me. So this healthcare system, we actually had the opportunity when we transferred over to look at a number of different healthcare systems. When we were talking to them, we just didn't get a feel of that family connection that our employees would be taken care of, that our families would be taken care of, and that they held the same values that we do here in Nebraska City. When we met with this health system, one of the first things they talked about was taking care of our employees, taking care of our patients' spiritual needs and emotional needs, as well as their physical and mental needs. And it really clicked with us. It went along with our values, and we just felt like this was the right home for us and for our patients and families. Well, when the patients come in, of course, they're greeted by our amazing front desk staff and our employees. My staff is great. They really work way harder than I do most of the time. They will get your vitals and your history, but they'll get a lot of the past for us so that we can go over that. We can really get to know you, get to know your past history, get to know you personally a little better with that first visit, because that all is incorporated into your physical and mental health. So we really need all that information. We need to be able to know the real you, so that we can put all that together and figure out the best way to take care of you and your family. When I'm not in the office, my sister kind of teases me. I've got a little different personality. I tend to be a little more laid back. I like to be outside. I love to be on water. That's my happy place. I love to be hiking. I love to be, playing horse with my kids on the basketball court. My husband is amazing. I spend time with him. My mom and family all live close by, so we've spent a lot of time with them as well. I'm in that season of life that we also do a lot of sports traveling, so I certainly sit on the bench quite a bit as well. But mainly we just like to get out in nature and kind of reset the brain and spend time with family and friends.